I have two questions. Yeah. First for Dr. Prisha. Yeah. About aside from the clinical presentation, which laboratory marker that you recommend us to use to justify the patient now are stable for go fixation or not? Which Thai laboratory marker that you recommend?
Actually, in my hospital, did not have any ROTEM or TEG at my lab. So I design only the general basic lab, like the hemoglobin level, interleukin 2 is can do, and lactate level, and about the INR that quite common to use in another hospital too.
Okay, thank you. I think now all of, not all, most of hospitals in Thailand can send the lactate level and INR. Any hospital that don't have, then can send the lactate level of patient. Bed access or pH also good enough to assess the patient if you can send the lactate level. I think every hospital can send blood gas of the patient. Yeah? And another question for Dr. Kantapon. Yeah. You suggest that in geriatric polytrauma patient, normally they cannot tolerate many operations at the same time, right? So do you have the suggest or recommendation of which region that you should do first for polyfracture or polytrauma patient?
So thank you for the question. So generally, as I show in my case presentation, that patient have hip fractures, distal femur fractures, and proximal humerus fractures, right? So as we know that two of the most higher mortality rate are the hip fractures and spine fractures. So I would suggest usually you do the axial skeleton first. So as in my case, I did the proximal femur first because with the proximal femur fixed, the patient can go back to sitting upright and you can start doing intensive respiratory activity to return to the lung function. So usually pelvic acetabulum or proximal femur fractures are the most important that you have to fix first. Another thing is that after you fix the axial skeleton, then you go down to the lower extremity to make them go back to walk, or even they can stand, right? And lastly, the upper extremity are one of the lower priority, but we still want them to go back to walk by themselves. So usually we are more aggressive in fixing all of the fractures. But as I show in the patient, they cannot tolerate it anymore. So that's why we have to leave it. Thank you.
Thank you very much for your answer. So now I think it's time that we can close this session. Thank you very much all participants to participate in this session. Thank you.